Good afternoon, everybody. I'm Mike Haddon, the Executive Director of the Utah Department of Corrections. I wanted to spend a little bit of time with you today to give you an update on what's going on in terms of the COVID outbreak currently within the Utah Department of Corrections, as well as some broader issues on how we're managing and working through COVID-19 here in Utah and within our prison system. And I'd be remiss if I didn't start out by saying that our staff are absolute heroes. We've talked about a lot of heroes in the community that are related to COVID-19, but our staff certainly are among those heroes that are showing up to work on a daily basis. The number of our staff that are taking the necessary precautions, as well as our inmate population, our offender or incarcerated individual population, have been taking precautions. It's been a long 6 or 7 months. Our department got working immediately on protocols and plans on how to work to try to prevent COVID-19 from entering our facilities, as well as to contain it once it got in our facilities. And we're grateful that it took until October before we ended up with an outbreak within our prison, which is something that I do want to talk to you today. I think it's important to explain what Utah's prison system looks like, and I'll try to be brief, but we actually have 2 primary prison sites, one here in Draper, Utah, one down in Gunnison, Utah, and then we contract with Utah County Jails for about a quarter of our population. Our current outbreak is occurring at our Draper prison site, which is really a campus rather than a prison site, made up of a lot of different facilities. Right now, the outbreak is occurring in one of those facilities, and it's called our Wasatch Facility. It's a really good example of why COVID-19 in a correctional or a detention facility is such a risk. We've seen it, I've seen it across the country, especially with my peers in other states, how quickly the virus can spread within a correctional environment, especially because it's a very confined environment. It's a congregate environment with people living together, and we have very little flexibility on moving people around. But I think what I want to do right now is just take a few minutes to talk about some of the rumors or try to answer some of the questions that might be surfacing right now regarding our outbreak with COVID-19 within the prison system. One of the questions is regarding commissary, which are food items and clothes and other items that our incarcerated individuals are able to purchase. There would be a concern that our commissary has turned off. Our commissary has not turned off. We've had an amazing participation by staff stepping in to fill orders for our incarcerated population, as well as some of our incarcerated population stepping up to assist us with commissary. We're a little bit behind, but our goal is to stay on top of that because it's very important for those that are incarcerated inside of our facility. There's also been questions about Culinary. Before I talk about Culinary, I want to talk briefly about the outbreak that we have currently at the Draper site. The Draper outbreak is located within one facility, which is our Wasatch facility. It is actually the oldest facility. It's the facility that was built and opened in 1952. Right now, we have 4 different what we call blocks that our population lives in. Our initial breakout occurred in B block, which is what we call Baker block. From there, a few days later, we ended up with a handful of positive cases in our Wasatch A block. So again, it's all confined to the Wasatch facility. Wasatch A block is right adjacent to Baker block, so it's not overly surprising that we saw spread go between those particular housing units. Also, as expected, once we got our initial positive cases, we knew our case count would go up and would go up pretty quickly. We've had the assistance of the Department of Health to come in and do testing, regular testing of our offender population. And those tests have revealed significant numbers of positive incarcerated individuals, both in our Charlie block, which is also in Wasatch, Baker block, and our A block. Those tests have come back with a significant increase in positive results. Again, this was anticipated and expected because of the kind of environment we work with within the prison facility itself. At this point in time, nearly all of those that are positive for COVID in those housing units are either asymptomatic or they're experiencing very minor symptoms. We jumped on top of both of those housing units very quickly. We locked the facility down so we could get a better idea of exactly where the spread started. We did contact tracing, and then we ramped up on testing. The more tests that we do, the more positives we're going to get in response, especially within those units. As I said from the very beginning, our focus has been on prevention and containment. We still are focused on prevention. We are also now actively involved in containment to try to minimize the exposure or the spread of COVID-19 within our prison facility, most specifically within that Wasatch housing unit. So that gets us to Culinary. The reason I delayed there for a minute is the individuals who provide culinary or the meals for our incarcerated population had been housed on our Wasatch A block, which has most recently had an outbreak. As a result, we've tapped into other staff as well as other incarcerated individuals to help us to provide meals within the facility. We have somewhere over 3,000 inmates currently at our Draper site. So you can just imagine, in terms of preparing meals, we're preparing close to 9,000 meals every single day, and we need all the assistance we can get. We are taking appropriate precautions in terms of personal protective equipment. Those that are coming into our Wasatch facility to help with culinary are coming in through the back door, and we're doing deep cleaning in between the meal provision. But those meals have to go on. We do have to feed our inmate population. There are some that may be wondering why our staff that are working in these facilities are wearing full personal protective equipment. And perhaps even why our incarcerated individuals are not afforded that full personal protective equipment. The reason is because our staff do end up working in different areas throughout the prison, and our focus is making sure that they don't become COVID positive and then end up spreading it to other areas of the prison. That's a key important thing that we're trying to accomplish. So in the end, even though it is our staff that are wearing the full protective equipment, including face coverings, N95 masks, eye coverings, gowns, rubber gloves, is to protect our inmates that are in other facilities. We care so deeply about our offender population, those that we have responsibility for, and we want to do the very best that we can to keep this from spreading to other areas of our prison. When we first started working through the COVID pandemic, one of the things that we did really quickly was we began screening all staff that were coming in to work at either of our two primary prison sites. We also provided face covers for all of our staff, as well as face covers for all of our inmate population, again, to try to prevent spread, and where we did have spread, that we would contain it. So our incarcerated population do have face coverings that they wear within their housing units. So they've not been afforded the full same protective equipment as we've just recently put into place, but they do have face coverings, again, trying to contain the virus from spreading anywhere else. A question is also asked about housing positive and negative inmates together, and this is something that we have learned with coronavirus. It's called the novel coronavirus for a very specific reason, which is we don't know as much about it because it's a brand new disease. One thing that we do know and that we've learned over the past 7 months are individuals can be positive for COVID-19 and not show any symptoms of COVID-19 until we end up doing tests for those individuals. The concern about negative individuals that are living in an environment where we do have positives is there's a chance that they are positive or will be positive soon, and if we move them to other housing units, we're concerned about COVID-19 spreading to other housing units at our Draper site and maybe even down to our Gunnison prison site or out into the county jails. So for right now, we're doing our best to limit movement from those housing units where we have positive cases. We're providing medical care, mental health counseling for those that are quarantined and kept in place in those housing units. And we are housing some positives and negatives together, but we are trying to keep them as separate as we possibly can. And I think it's important, again, to reiterate that those who have tested positive, nearly all of them are asymptomatic or have minor, if any, medical consequences from that positive result. And that kind of goes to another question with a similar answer, which is, how did we go from 3 COVID positive incarcerated individuals to the numbers that we're experiencing now? We're now approaching 200 positive COVID cases within the facility. But again, they are confined to those 2 blocks, Wasatch A block and Wasatch Baker block. The reason for the increase is as soon as we received positive tests, our partners with the public health areas, whether that's Salt Lake County Health Department or the State Department of Health, as they come in and they do those mass testing, that we will end up with additional positives. So that's the reason why we have so many additional positives, because we're testing and we're getting results and we're finding out. Another question that's come up and something that we focused on is early release. Trying to get offenders out of harm's way where we can. Let me again state how amazing our staff have been, our partners with the Board of Pardons and Parole as well, to focus on trying to get individuals out of harm's way as much as we can. Specifically those vulnerable population and the older population, trying to get them moved, either housed together to keep them out of harm's way or to get them released out into the community. One thing that I can tell you is our inmate population today is the lowest it's been in 17 years, so that effort has been paying off to move people out of harm's way everywhere we possibly can. The individuals that are being released are, again, in consultation with the Utah Board of Pardons and Parole, who are reviewing the cases individually. Primarily, these are individuals who had a release date from prison within the next 6 months, so they were about to get out anyway. Or they're the medically fragile individuals who are looking for a compassionate release in order to get them out into the community and away from the confined environment of the prison. We continue to work with the Board of Pardons and Parole and others to release those that could potentially be released, while keeping a very close eye on public safety concerns as well. Final question and then a few observations. One other question that we receive from time to time is regarding copays or costs associated with COVID-19. None of the incarcerated individuals who are being tested for COVID-19 are paying a dime for that test. Those that are positive for COVID-19 and are receiving medical care will not be charged a copay or any medical charges for them to receive treatment. Finally, we will strive to keep you updated day to day, maybe every other day. It's a big deal for us to be as transparent as we possibly can, which is why we're doing this video, why we've done releases and updates to our public website, as well as newsletters out to our incarcerated population so they fully understand what we're doing. We're trying to be as responsive as possible to a lot of questions that come in. We realize that there are family members and loved ones in the community that are concerned. That is something that we're very aware of, and we're hoping that this will alleviate some of that concern. at least knowing that currently our spread is only within 2 housing units. The medical consequences have been minimal to none whatsoever. So we will continue to try to respond to inquiries as we get them, but we do get a lot of them. And at the same time, we're working very, very hard with all of our staff and all of our leadership to develop processes and protocols to continue to focus on the prevention and containment. So we're trying not to get distracted too much as we work to develop solid plans that were developed 6 months ago in order to try to keep COVID-19 out of our prison facilities, and as it is entered, trying to contain it within our facilities. That's all the updates that I have for today.